Hi, welcome to Doc Martin's Quarantine video series. Quarantine is the perfect time to do things that you've always wanted to do, but never actually had the time for. For me, it's about starting a YouTube channel. The intention of the channel is to provide you with practical information that you can use to improve your health. For the first video, I'm going to be talking about something that's very near and dear to my heart, and that is chiropractic. This video has two parts to it. The first part will be general information on chiropractic as a profession. The second part will be an evaluation and treatment demonstration, exactly how I would do it in a clinical setting. Chiropractic is not new. It was actually founded 125 years ago in 1895 in the United States of America by Dr. Daniel David Palmer. In the Philippines, it's been around for approximately 100 years. Internationally, one gets a Doctor of Chiropractic degree only after 6 to 7 years of rigorous university or college-based education, which includes 1 year of clinical internship. Doctors of chiropractic are awesome, and they help millions of people worldwide. People see them for all sorts of problems. Problems with their back, problems with their neck, problems with their shoulder. Sometimes they'll have a scoliosis, other times they'll have nerve pain like carpal tunnel, and all sorts of other conditions that affect your nerves, your muscles, and your body. In sports, chiropractic has been used to enhance athletic performance. We can even help people with conditions that are seemingly unrelated, such as headaches and dysmenorrhea. How does chiropractic work? Simply put, chiropractic corrects. Chiropractic corrects alignment. Chiropractic corrects muscle tone. Chiropractic corrects nerve flow. Chiropractic corrects and restores tone. Now, what is tone? Tone is a healthcare concept, which is an outwardly expression of health and vitality. You may not notice it, but you assess tone unconsciously on a regular basis. When you see a friend and they're not looking well, you're looking at their tone and you say, "Are you okay?" If you see someone who looks good and vibrant and energetic, you say, "You look well, your tone is good." The nurses call it the healer within, and the surgeons will make a call on whether or not this patient is a good candidate for surgery based on their assessment of tone. What do you expect when you see a chiropractor? Okay, step one. Your chiropractor should take a detailed history of your injury and a medical history to determine whether or not you are a good candidate for chiropractic care, or if we need to refer you to another healthcare professional that may be able to help your condition more. We're moving on to the second part of the video where I'll be demonstrating a chiropractic evaluation and treatment. Now to help me out is my quarantine buddy, my lovely daughter, El Camara. is here. Okay. Relax your shoulders, please. Take a deep breath in. Exhale. Little. Nice. That moved really well. Okay. Next. Take a deep breath in. Exhale. Nice. Good. Take a deep breath in. Exhale. Nice. This one here, that's your C2. Just relaxes. Nice. Here, gonna have to go a little bit lower, okay? Just relaxes. This muscle does. Nice. Good. How does that feel?
Good.
Excellent.
Yeah.
All right.
Oh my gosh, those crack noises were so good.
I hope that you enjoyed Doc Martin's very first quarantine video. Don't forget to hit like and subscribe. I will be posting videos like this to help you improve your posture and get rid of back pain. If you have any questions at all, please write them in the comment section below and I'll be happy to answer them when able. Stay happy and healthy always.